Hi then, welcome along. My name is Paul Goff. Today I'm going to talk to you all about knee ligament sprains. More specifically, we're going to look at medial knee ligament sprains, which medial just means that you've got pain on the inside of your knee. You might think that these are classic sort of sports injuries and they're very common in runners or people who play football, that type of thing, rugby, those type of games. But it's also common in a person who can simply slip on the ice, may have fell, landed awkwardly, got off the bus, missed a step, those type of things. So it's not just a sports injury. These are definitely sort of injuries that you would see in everyday life as well. So today we'll look at what a medial knee ligament sprain actually is, why it's a problem for you, not just in terms of the pain that you're feeling, but we'll also look at why it's a problem in terms of the restriction, why you're struggling to do the things that you want to do, and we'll also look at how physio can help. I'll introduce you to myself. That's me, and that's me working with Darlington and Middlesbrough football clubs. That was my job before setting up this physiotherapy practice, and that's me more recently working in America with Manchester United footballer Paul Scholes. So you can imagine this is a common injury in sport, so quite familiar to me, these medial knee ligament sprains. Before we go on, I'm going to introduce you to the real problem with a medial knee ligament sprain. It's this thing called scar tissue. The best way I can get you to understand what scar tissue actually is, think of glue or cement. If you were to damage something in your home, the first thing you'd probably do is to try and fix it. You'd use some sort of glue or some kind of cement to try and fix it. So scar tissue is exactly the same. And when you damage this medial ligament, now that image there that you're looking at on your left-hand side would be of a person's left leg. Okay, and the thing that's highlighted is exactly what the medial knee ligament is. So you're looking at a person's left leg, so that would be on the inside of a person's left leg, and the bit that's highlighted is the medial knee ligament. And if that gets damaged, this scar tissue is exactly what your body needs, and it's great, but one of the problems is it ends up too stiff and too tight. Too much glue gets laid down and too much cement gets put down if it's not treated early enough, and your knee ends up really stiff. And you may be experiencing this now. If you're watching this video and you've just damaged your knee or your injury, you're experiencing the sharp pain, the swelling, all of the things that you would associate with any injury. But if you're watching this video 2 or 3 months down the line and you're still in pain from this medial knee ligament injury, then it's because of this thing called scar tissue, and this ligament is now too stiff. It's not that it isn't strong or it hasn't healed, it is just now too stiff. So we'll look at that as we go along as well. But first, let's confirm that you do actually have a medial knee ligament injury. Again, if you have a quick look at the image on the left hand side of your screen, you can see I've highlighted this medial ligament, another image of it so you can understand it. That would be on the inside of a person's left leg again. And more often than not with a medial knee ligament, it'll be through a fall or a twist. Classic sports injury. You've been playing football or cricket, you've stood, you've gone into the ground and you've twisted. Your upper body's turned one way but your knee stayed in position. Or a block tackle, a really common injury. This happened to David Beckham a couple of years ago and out for quite a while, and it is a very, very common injury that you would see from a block tackle where, again, your knee goes one way and your body goes the other. But it could also happen to a person quite innocuously, quite simply, stepping off a bus, slipped on the ice, knee gives way, getting off a set of ladders and you miss your step and your knee goes down. So it's not just a sports injury, like I say, it can happen to anybody at any age. One thing's for certain, it is horrifically painful and you get this really, really sharp pain on the inside of your knee. More often than not, you get the swelling as well. It feels really hot. So it can also really be painful when you twist or turn, and what that means is you might get to a point where pretty soon you can walk in a straight line, you can just sort of walk to the shops and back, but as soon as you need to turn or you need to twist, for example, to turn around a corner or to cross the road quite quickly, as soon as you do that, your knee won't let you do it, and that's a classic sign of a medial knee ligament sprain, in that you can walk quite comfortably and quite safely in a straight line, but as soon as you need to turn sharply, you'll get that pain on the inside of your knee. And one more thing with this, a side foot pass or a block tackle will be horrifically painful. So as soon as you go back, and even it could be a month or 6 weeks later, you're still trying to kick a football or you're still trying to get involved in a tackle with sport, you will get that pain in the exact spot that I've highlighted on the image on the left hand side there for you. So what exactly is a medial knee ligament sprain then? Basically it's a tear in one of the ligaments that are on the inside of your knee. That's the critical bit. The medial bit means just that it's on the inside of your knee. Is it torn or sprained? It doesn't really make any difference. It's just a terminology that medical people use. All that you need to understand is that bit that's highlighted there, 1 or 2 of the fibres have been damaged as a result of that twist or that fall or that block tackle, and it means that the ligament has been stretched too far and too fast. So that's kind of what's gone on. The best way I could get you to understand it, think of an elastic band. If you pull an elastic band at one end and pull it at the other, somewhere in the middle is going to be a lot of tension, and there's a chance that that band will snap or it'll fray. Now, ligaments of the knee do snap completely, and if they rupture, you'd be looking at surgery. It wouldn't be physio that can help, but if it's just a knee that feels really loose and you've damaged it, kind of quite simply, you fell or you've twisted, then those are the type of injuries that we see with swelling and pain, restriction, all those things. So we can help you with that. But think of the elastic band. If you pull that ligament too far, you pull that band too fast, too tight, it'll fray or it would snap. And that's kind of what's going on with your medial knee ligament. And this glue, or this cement, this scar tissue that I mentioned earlier, is the thing that your body's going to use to get that ligament stronger again. But if it doesn't get molded in time and it doesn't get made to be more flexible or more elastic pretty quickly, you'll end up with a knee that's too stiff. So why the pain and the restriction? Well, the fibers are torn, so you tear anything and it's going to be painful, but it means that it's weak. And when it's weak, obviously you're not going to be able to do the things that you would normally take for granted. Something as simple as going for a walk in the sort of hills or the woods at Gisborne is going to be pretty painful, even around Durham, because the uneven surfaces mean that your knee has to have that little bit of give and that little bit of movement in it. But because this knee now is really weak, you're probably going to have too much movement. The swelling, very, very common, particularly when really severe cases of a medial knee ligament injury. It's there for a reason. It wants to make you immobile. Ice is great for that, as is a compression bandage. Don't leave it on in the night, but a compression bandage and ice through the day are great in the short term. Don't use it too much for too long, because again, you'll end up with a really weak muscle and sort of weak knee in that area, which isn't great in the long term. And what we find often, the restriction comes because the knee just doesn't heal right. It heals wrong. And that's because of this scar tissue that I mentioned. The number one problem with knee ligament injuries, and more often than not when we end up seeing a person, it's because it's 6, 12, however many weeks later, they've rested this knee and it just isn't getting any easier. It's getting stronger and it's getting better. It's just too strong. So as a physio, we need to get that scar tissue molded as quickly as possible. How can we help? What would we do for you? Well, you need hands-on treatment for this pretty quickly. We need to get our hands on that ligament and start stretching that ligament, start molding it, start making it more flexible and more elastic, kind of how it was pre-injury. And hands-on treatment is the best way to do that. We'll give you an explanation of your injury. We'll tell you exactly how you've done it. But also in that explanation, you can expect to be told what you can do safely. So if you love to play football, you might not be able to do it as soon as you would like, but we'll tell you the things that you can do to keep yourself fit and active. And if it's just simply you love to go for a walk, we might advise you on things like swimming or bike riding, or you can go for a walk. If you live in somewhere like Hartlepool, you could walk along the seafront, which would be great. But if you live in somewhere like Gisborne or Durham, where it's really hilly and uneven, then you may need to adapt your route a little bit. So we'll talk to you about that as we go along as well. And you can also expect some fantastic exercises for you to be doing to strengthen that quad and that core stability area. Number one reason to visit a physio, anybody asks me, is no other reason. You need to know when it's safe for you to return. Not when it's okay to return, when it's safe for you to return. And what that means is when you're going to be the least chance that this injury is going to happen to you again, which, by the way, particularly if you're involved in sport, it's very common for people to go back after sort of 4 or 5 weeks. The initial pain's gone, but now because it's so stiff and so tight, they're at a great risk. They're at a really high injury risk, what we call, where there's not enough flexibility to allow them to get back to sport safely. So we'll guide you through that as well. So briefly, what you would get from us, it's going to take about 3 to 4 weeks. You'll need about 3 or 4 sessions minimum. Sometimes that can go to 5 or 6, depending upon how bad it is and how long it's gone on for. And you would need deep tissue massage, lots of stretches, and also advice on exercises that you can be doing at home. So where are we? Well, we're in Darlington, Durham, Gisborne, Hartlepool. That's exactly where our physio clinics are. And you're looking at an image there from the inside of one of our clinics in Hartlepool. And what we always offer, get your session free if physio can't help. So any injury that you visit us, it's quite a unique offer. Not many clinics in the area do this. But if it turns out that it's an injury that we can't help you with, we never charge you for your session. And at the very least, we tell you where you need to go to get yourself sorted in the long run. So the number you need to call us to book your physio session is 0800 043 8671. And just to recap, I'll actually, just before I do that, I'll show you a little bit of an image inside. This is live inside the Gisborne Clinic. That's what you can expect to see if you come to our Gisborne Clinic in Challoner Street. Our staff, well, anybody you meet that works in this premises or in this clinic, they're very active, they're very friendly, they're very outdoors, and we do lots of stuff like yoga and Pilates, and that is actually live image of an in-house yoga class that our staff take part in every Wednesday morning at 7:30 before work, and that's in the Hartlepool Clinic. That's Vicky looking after 1 or 2 of our patients who've come in. So that's kind of what you can expect to see when you do visit these clinics. And just to recap, If you have a medial knee ligament sprain, we can help you. We'll give you hands-on treatment. We'll give you an explanation of your injury. It's tailored to you. We'll give you exercises to do at home to help your recovery, and we'll tell you exactly when it's safe to return. The number you need to get all of that is 0800 043 8671. Like I say, we're in Darlington, Durham, Gisborne and Hartlepool, and we can definitely help you with this injury. That's it for me. Thanks for watching. Take care, and I'll speak to you again soon.